Kevin, were you about to add
Well,
something?
I think it's also why it's important for us to remember that that's occurring, and we need to be better at explaining to the public what we're doing so that they recognize, you know, that we're out doing the food inspections, and that therefore the food establishments that the public eat in are safe, to be there.
Absolutely.
So, you know, some of that burden falls on us.
Absolutely. A conversation we've had many a time, right, on public health
And this
marketing.
is why having a program like the School of Public Health, where we train professionals that can then work in the health departments at the state and local level, becomes so important. We're really facing a tremendous crisis in the country right now, because we're anticipating that about 25% at least of those who are currently employed in public health, and we know it's already a shortage in public health, but 25% of them may be retiring within the next 5 years.
Right.
So you look at that, plus the decrease we have in our employment status within public health, and we're really approaching a crisis.
Now, what are some of the programs that you offer? I'm glad you're mentioning that, Dr. Gotch, because there are some specialties, correct, within the School of Public Health to help prepare professionals for
Just
this.
like medicine, we also have specialties within public health. You mentioned statistics before. We train biostatisticians who frequently will work in industry, working on clinical studies, randomized clinical studies, for example, in pharmaceutical companies after they graduate. Environmental scientists who really are looking at some of these issues that you were just talking about. Understanding the science behind the various factors that cause an illness. For example, lead, asbestos, all of these were brought about through their work, and also epidemiologists to figure out where it's happening and who's being impacted by it. So epidemiology becomes a key discipline within public health.
Absolutely.
And we're talking about communication, and health education is a position that frequently will reach out through communication to communities to explain what the issues are and to help change the behaviors that we're talking about. So the health educators are another one of our professions, and then health administration that work in sometimes hospitals, some of the settings that you were talking about before, helping to change policy, write legislation. So these
critical
are
pieces, critical pieces.
So we offer a Master's of Public Health degree for all of these, and also dental public health is another specialty within our School of Public Health. All schools of public health don't have dental public health, but we do within our school. And so all of these professionals together work either through health departments, local health agencies, volunteer. So it's a variety of settings in which they work.
Great. Now, you have campuses, excuse me, not offices, throughout the state. Is that correct? And
yes, we have a campus up in Newark. And also on this campus in Piscataway, New Brunswick, and down in Stratford, Camden.
Excellent.
So
it's accessible from all regions of the state.
And then some of our courses we're starting to offer by IP video, so that a faculty member can be in one location and the students, of course, in another.
So online distance learning, which is
And we were also designed as a program for working professionals, so that those who have a full-time job can come to us in the evening at 6 o'clock and take a full course in one night. So that helps as well for those who are wanting to move forward and just can't quit their job to go full-time to a school.
Right. Now, I believe there's also a public health certificate program. Is that undergraduate level or graduate level?
It's at the graduate level.
It is, okay.
And we now have 5 different certificates, and we'll be adding some more, and you can go onto our website and see what those are.
Great.
But one that might be of interest would be the 5 core areas of public health that I just mentioned, to give a foundation of public health. And so you can receive a certificate in that. And then after going through the certificate, if you decide you want to go on for a degree program, could then seek admission for the MPH program.
Excellent.
And those courses would all then apply to any of the concentrations that we have.
So that's a nice taste, I think, for people to just explore it a little bit more deeply and see if that's the direction they want to go.
And I think it really speaks to the diversity of public health, which is part of the reason I love it so much. I mean, we really touch on everything in life, and as Dr. Gotch just described, a lot of different disciplines, a lot of different work areas. So it's a great potential career for somebody looking to either change careers or enter the career market. And we have a great impact on the life of people. So.
Absolutely.
You know, it's a very exciting time to go into public health. There are many challenges yet facing us in public health.
And some that we just can't even anticipate, right? There's always something new that seems to come around the corner. Kevin, do you typically, or maybe not just your health department, but is a master's degree typically required, or can you have an undergraduate degree maybe in biology or environmental science?
Yeah, it really depends on the position in the department, but it's certainly not a required degree. Most of our environmental health specialists are not master's trained. They have backgrounds in biology and science. Some of the upper level positions, administrative positions, do require a master's degree, supervisory positions, but there are the field personnel, even health educators, and as I mentioned, the environmental health specialists come from different backgrounds. Biology, maybe it's nutrition that is beneficial. So it really varies within the department. Again, speaking to the diversity.
Right. And what's useful about that information, I think, is that if someone's not quite certain yet, if that's the route they want to go, they can still begin working in that profession and start to get the taste of it, and then decide, yes, you know, the master's is absolutely appropriate, and certainly that would help them to advance further in the profession. But
well, and a lot of us
it gives them a little exposure.
A lot of us that are in public health today really didn't plan on being in public health. We kind of fell into it from another area.
Yeah, that's right.
But what we need to do, because of this great potential shortage in public health, is make people recognize that it's a field they want to go into from the beginning.
Right. Now,
and because we're accredited with Rutgers and NJIT as a School of Public Health, we also have articulated degree programs with undergraduate programs. So, for example, if you're at the Blaustein School in New Brunswick, you would be able, at the bachelor's level, to take several master's level courses that would apply towards your undergraduate and then give you advanced standing in the master's program.
Great. And there is also an undergraduate degree in public health, correct?
Oh, definitely.
So ideal to be in that environment, or pursue that if you're high school students who may be watching this. That's a route to consider as well. You referred earlier, and we just have a few minutes left, but I just am hoping you can mention some of the other environments that you see public health being applied. What sort? It's not just the local health department.
Oh, no.
And maybe you
everything.
can just, either of you can just share a few brief words before we end.
Well, there's governmental positions, there's non-governmental positions in private industry. I think you mentioned the pharmaceutical companies.
I mentioned before, volunteer agencies, American Heart Association, cancer.
All the not-for-profits have some impact on public health in some way or another.
And that's exactly where I started. In that
foundations. Foundations.
Robert Wood Johnson type foundations.
Visiting nurse societies and associations that are looking for nurses, and on top of the public health shortage, there's a nursing shortage. So combining those two, it's a real need for public health nurses.
Absolutely.
So a lot of different environments to work in, even not the government, but in policy-making government positions, legislative offices with public health specialties, or organizations like NACHO, the National Association of County and City Health Officials, or the American Public Health Association, that have employees that are working in public health. So a lot of different environments, a lot of different roles for public health employees.
And then we also have dual degrees. So frequently it'll pair up with law or other disciplines. So where public health is practiced becomes very diverse because of the way we're able to have this opportunity for collaboration.
Excellent. And it's funny that you mentioned law. I mean, public health law, particularly in these last 5-6 years, as we've moved into sort of emergency preparedness roles, which we're not, it's a whole other program, really. But it's a whole new venue of exploration, really. Public health law has changed dramatically and needs to be reframed in light of new changes.
Absolutely, because as they write the laws, they need to understand the public health aspects of them. So it's very important.
Absolutely. Well, thank you both very much. I think this has been a very enlightening program, and thank you for your time. I just want to remind viewers that most of the content that we've discussed today, along with the websites for the UMDNJ School of Public Health and certainly for Middlebrook, you can identify on the Middle-Brook Regional Health Commission's website, and that is www.middlebrookhealth.org. And if you have a few minutes, we also would love for you to take a moment to complete a survey online. We'd really like some feedback about today's program. Suggestions for future topics are welcome. We really appreciate your feedback for this program. So thank you very much for joining us, and we'll see you at the next one.